Hi, everyone. My name is Ashley Brooks Russell. I'm an associate professor in the Department of Community and Behavioral Health, and I'm also director of the Injury and Violence Prevention Center. I want to talk to you today about some of our findings from high school students in Colorado. And this is from the Healthy Kids Colorado Survey, which is a surveillance system that we run here at the university on behalf of the State Health Department. I'm going to talk to you today about some of the unexpected improvements we saw in adolescent health during the COVID-19 pandemic. I want to acknowledge my research team and, of course, our funding from the Colorado Department of Public Health and Environment. So what we know about COVID-19, especially during the early months during 2020, is that there were very significant and rapid changes to adolescents' social environments. We saw most schools shut down and go remote. And then as schools came back, some schools did a hybrid model where students were in school some days a week or shortened days in order to provide for more physical distancing in the school environment. We also saw parents working from home, and so likely they were around their teenagers more, being able to track what they were doing. And then social engagements, parties, dances, things like that all got canceled. And so teenagers had less in-person peer interaction. So we wanted to understand this. We normally survey schools every other year in the fall of odd years. So we had just surveyed schools in fall of 2019, right before the pandemic, and we weren't scheduled to survey schools, but we wanted to make sure that we were tracking what was happening during COVID. So in 2020, we invited any school that had participated in 2019 to participate in a special voluntary administration of the survey. So this led to a cohort of schools that had participated in both 2019 and 2020. This was a total of 26 schools and a total of about 5,000 students in both the fall of 2019 and 2020. In 2019, we had done the survey paper or online, depending on how schools had preferred to do it. But in 2020, knowing that many schools were virtual or students may be learning virtually, we only offered the survey online, and it could be done in person in school online or at home online. Our sample was predominantly rural for this voluntary cohort. When we do a state representative sample, we find that about half our schools could be categorized as rural and the other half split between urban and suburban. But when we asked for a voluntary sample, we found it was more likely to be rural. And this, we think, is because many of the large urban school districts were just too overwhelmed by the administrative burdens of dealing with COVID-19 and weren't able to provide the survey. However, we found that our samples were similar as it related to free and reduced lunch percentage, which is our measure of poverty. We found most students were learning hybrid at the high school level, 10% virtual and 33% in person. And what we found is when we compared within these participating schools from 2019 to 2020, there was a decline in substance use. This was consistent across alcohol, e-cigarettes, marijuana, cigarettes, and prescription drugs. And we think the mechanism is that students weren't around their friends or didn't have the opportunity to get or use substances. And this is consistent with the self-reported perceived access, which also declined across all substances from 2019 to 2020. Surprisingly to us, we saw some improvements in mental health. From 2019 to 2020, we saw some declines in having considered suicide or suicide attempt. This is not consistent with what we're hearing in a lot of the media reports. And I think more remains to be understood about why this could be that in our sample, we did not see a drastic worsening of mental health, whereas we are seeing a lot of concerns about rises in suicide risk. Our best guess is that in these communities, which are not necessarily representative of the state, there may have been increases in feelings of family connection or parental monitoring, which may have buffered some of the stress of the COVID-19 pandemic and offered some benefits. If you'd like to be involved in the survey, feel free to reach out. My email is here, or if you have any interest in injury and violence prevention topics, please feel free to reach out. And if you want to use the Healthy Kids Colorado data for a capstone or a practicum project, particularly for an analysis question, please feel free to reach out. My name here, ashley.brooks-russell@cuanschutz.edu. Thanks so much.